Clear channels, promote blood circulation, recommended duration, 15 minutes. Apply some oil to your hands and warm it by rubbing it between your hands. Stroke from the neck down to the waist using both hands, and then return to the neck. Finally, gently press the feng qi and feng fu points. Using both hands, alternately push the du channel towards the waist, then return to the neck, followed by gentle pressure to the feng qi and feng fu points. Using both hands, alternately push the bladder meridian towards the waist, then return to the neck, followed by gentle pressure to the feng qi and feng fu points, starting with the left side. Alternately push the entire scapulothoracic joint using the huku of both hands. Push Dabin meridian from the back of the neck with bent fingers of both hands. Push Dabin meridian using the huku of both hands, starting with the left side. Push from the shoulder to waist side section by section with bent fingers of both hands, then return to the shoulder, and push to the elbow. On one side of the back, horizontally push bladder meridian with thumbs, from the scapula to the waist. Alternately stroke from the waist side to the shoulder using palms, and end at the palm. Repeat on the other side. RF and suction application. Recommended duration, 15 minutes. Recommended energy level, 3. Suction intensity, set according to individual endurance. Recommended suction time, 0.5. Recommended release time, 0.2. Suction time should be longer than release time. Push du channel in 3 sections with the handle. Push the whole du channel on the back with the handle. Push bladder meridian in 3 sections with the handle. Push bladder meridian with the handle. Glide the handle in circular motions along bladder meridian to Buildup point. Move the handle back and forth on Dabin meridian from the neck. Move the handle back and forth on the scapulothoracic joint. Move the handle from the left waist side to the right waist side back and forth. Wipe the treatment area with a towel. Note: avoid sauna, hot springs, or strenuous exercise after treatment. Take a shower 4 to 6 hours later after treatment. Keep warm, do not eat cold, spicy, or stimulating food, drink a lot of warm water, and keep hydrating to promote metabolism. Take 2 to 3 sessions a week, and a course of treatment is made up of 12 sessions. Contraindications: women in the period of pregnancy or lactation, people with heart disease or pacemaker, people with unhealed wounds from surgery or in the recovery period, people suffering from epilepsy, severe diabetes, hyperthyroidism, or malignant tumors, people suffering from skin disease or infectious disease.